Thank you for your patience. In spite of, I would like to invite the woman who has been head of our nursing institution, a leader, a mentor, and she is very talented and hard-working personality. We are very glad to have the person and principal of our Indira School and College of Nursing, Dr. Kavita, MSc Nursing, PGDHA, PhD in Medical Surgical Nursing, to let the graduate in residing the nursing place.
I solemnly pledge myself before God.
I solemnly pledge myself before God.
And in the presence of this assembly.
And in the presence of this assembly.
To pass my life in purity.
To pass my life in purity.
And to practice my profession faithfully.
And to practice my profession faithfully.
I shall abstain from.
I shall abstain from.
Whatever is deleterious and mischievous.
Whatever is deleterious and mischievous.
And shall not take.
I shall not take.
Or knowingly administer any harmful drug.
Or knowingly administer any harmful drug.
I shall do all in my power.
I shall do all in my power.
To maintain and elevate the standard of my profession.
To maintain and elevate the standard of my profession.
I will hold in confidence all personal matters.
I will hold in confidence all personal matters.
Committed to my keeping and of family affairs.
Committed to my keeping and of family affairs.
Coming to my knowledge.
Coming to my knowledge.
In the practice of my calling.
In the practice of my calling.
I shall be loyal to my work.
I shall be loyal to my work.
And devoted towards the welfare.
And devoted towards the welfare.
Of those committed to my care.
Of those committed to my care.
Thank you.
Thank you, ma'am, for your dedication pledge. I request the entire body nurses to sing a song and dedicate themselves.
Take my life and let it be consecrated, God, to Thee. Take my movements and my days, let them flow in ceaseless Christ. Take my hands and let them move at the impulse of their love. Take my feet and let them meet, swift and beautiful for Thee. Take my silver and my gold, not a mine to die with gold. Take my intellect and use, every power those shall choose. Take my will and make it thine, it shall be no longer mine. Take my heart and this thine own, it shall be the royal throne.
Thank you all for your dedication.
Thank you.
Body nurses are requested to present your lap in front of the Nightingale frame.
லைட்டில் போட சொல்கிறேன். லைட்டு போடலாம். இது இல்லை இங்கே இவங்க
ceremony, he is none other than Dr. Gopichandran, PhD Nursing, NIMHANS, Bengaluru, and he is National EC member TNI 2020 to 2023, NAPH accessor, Principal Investigator of ICMR funded project and UCL and AIDS project, and he is also a BSL and ACLS and CCLS faculty, ATCM faculty, International Society of Trauma Nurses, coordinator and faculty of Pan India Nurses, led models and CAP program, and also a PhD guide AIDS Delhi. He also do the researcher sites, nurses led model care in transition care and palliative care, and AI app-based educational intervention in management of patients with chronic disease, and digital education for building nursing workforce capacity, and telenursing in management of patients with chronic disease, followed by the area of expertise, teaching and skilling trainer, nursing administrator, student career counselor, patient advocate, clinical trial, clinical policy development, curriculum development, career counselor, and nursing academic and clinical audit, nursing leadership and communication, skill training, and team management.
Anbarasi College of Nursing at 1993 to 1997, and he started his profession 1997 to 1998 as ICU nurse in a Malar Hospital, Chennai, and 2013 to till date he is assistant professor and consultant in neuro nursing, a department of nursing in NIMHANS and Bengaluru in India.
And 3 institutional awards, and he is a distinguished alumni awarded in 2020 at Sri Ramachandra University, and he published 55 top publications and 3 books. In that, he published B.Sc Nursing 2nd edition of CET. And also he published a level scientific paper and also a guest lecturer. He has invited around 160 national conference as a speaker. And he is organizing a chairperson of webinar to empower the nurses. Around 17th webinar he organized. He also guided a MSc nursing thesis in AIDS at New Delhi. We are honored to welcome you, sir.
Respected Chairman Sir Thiru Indira Raajendran, and Madam Indira Raajendran, the Managing Director of the Public Education Institutions, and my friend Kavita, we were batchmate when we were doing the post-graduate diploma at NIMHANS. But I am very proud the Vice Principal, faculty members, all of the students. So really it's a proud moment for me. Why I am telling the 2 reasons. I was a little emotional when I was, we people are doing LAM lately. Why the reason is, I was doing the same thing 1993 in Anbarasi along with my friend Dr. Sudhakar. He was a principal here. I was seeing the boys who were coming together. I was there, because it is not. I am hearing about Indira Nursing College today. When he joined here after came, because we were batchmate, we were roommate, we were again PG mate. Again we went together in our Gulf country. We worked together. Again I joined at the AIMS. He selected that Indira College he was working. So he was completely communicated. One day it was great, news. I mean, it's very bad news, I can say. He is no more today. So that moment, I was, he called me twice to come here for one of the workshop. Even one of the faculty told me, sir, he was telling every time I want to call my friend Gopi here. When he was there, I was emotional. When I met, I think 2-3 months before I came to Savita College of Nursing, they invited me. That time I have seen your student. They told I am from Indira College of Nursing. Again I was down. The reason is the Sudhakar. During my talk also I told about him. 23 years I'm meeting her today. And she called me, I joined at NIMHANS 4-5 months. It's a position what I'm here. I think everyone may be knowing now. It's a consultant, means as an independent person in nursing who can see the patient, who can treat the patient, same like a doctor. That taken time for me 22 years. People ask me why I come from AIMS Delhi. You see my background, AIMS Delhi, I am the TMA president, I am the Society of Cardiac Nurses founder. I was so many things. I am the worked as senior most faculty and I am the coordinator of whole program AIMS Delhi. But that time I am not at par with the medical faculty. I am nursing faculty. When I got the selection of NIMHANS at par with the medical faculty as a consultant, the first position open for medical surgery before given for psychiatry. Because this qualification you have to get PhD after 3 years. What you would need all the publication, everything, then only we can attend the interview and selected by the government of India. So this is what I am telling. This is the travel of 23 years I get into the be independent, because it happened in other country, but in India it is not happened. I think everyone knows that still need time. I think we will maybe progress future, become practitioner, nurse practitioner, and also we are post also will be at par with the medical person. This is what happening in other country, India, but today nurses are coming up. Again, I am going back 1993. I am the first batch of nursing students, male batch. We were the first batch in Tamil Nadu. We were selected at the top in the school, so many things in the academic. Started my school is Urachi Undi Tropapalli in Thiru. And government ISM school. Even today, I am very proud to say, from Tamil Nadu, the top in the school. Today, especially this government, I am telling. Everywhere we come to know that the government schools are so good, that much. But before we talk about 20, 30 years before, I think I don't want to tell still that there is a lot of difference, but no different today. So much improvement has happened. We started, I don't know how to speak English today what I am talking. That's why I am telling, motivating everyone, what Alai, madam and sir, I think very proud to say, so how you motivate, really they are gifted, I am telling. Because that motivation is the most important after the parents. But today I am also trying to motivate you. Only one reason is, the language is one of the barriers. We don't go out of the Tamil Nadu. That is not the barrier. Language is language only. Okay, that is not knowledge. The knowledge inbuilt for all Tamil. It is no one can stop because genetically bounded. But knowledge is make you fear. But today's generation is better because they are studying Hindi and everything. But during that time we have faced a lot of problems. Even when we are doing seminar and all MSc, we don't know, we just read out. Still I remember in Ramachandra, I was the first batch of MSc. Some of them who from Chennai, they are very good in talking and all. We used to read all the slides one by two, next 30 slides because we are very much fear to talk. But we improved a lot. That is called transformation and we have experiences. So I am telling one thing, very happy to see today, all very beautiful, the way they are organized and all the today heroine of this day and the decorated the way. The nursing is different than other professions. Only the reason everyone knows that what Florence Nightingale transformed the way today many nurses are coming up. And just to make you one tips that understanding for you, you can become qualified nurse after completing the 4 year, 5 year, whatever that duration you are doing, 3 years or 4 years, 4.5 years. Now every time curriculum changing. But even you work as a different role, different position or PhD, whatever it is. But unless until you are not transformed, you cannot become the true nurse. There's a lot of difference between true nurse and qualified nurse. This is what I realized. Even I do so many PhD, everyone doing. But become the nurse, true nurse, it takes a lot of time. That time you need to transform yourself. That's what happened to Nightingale. Why I am telling you, she is the statistician, she is the rich lady. She devoted everything. She realized, she felt the satisfaction when she was during the time of Crimean War. She was helping the wounded soldier. That time she thought that what satisfaction I am getting. This is not I am found. I have become so whatever I am. But this information I was not getting when I was like you when you taking the lab writing. Because lab writing is a transformation. The teacher transforms to the student to understand exactly what is nursing. What you are going to be compassionate person tomorrow. Not knowledge. Knowledge definitely, every writing is source of knowledge. There is no doubt about it. Knowledge is encompassed But that feeling is compassion. I am telling that compassion will not come immediately. But it's most good with female because females are highly valued people which you are getting from a mother, not like boys. Even Kavita telling, I asked them to cut the hair, make discipline today. We are very naughty. We may not easily to come up, but once we are understood, we are so better. That's why Sir was telling today, male nurses are so good. I have seen one example I am telling recently happened in Children's Hospital. One fire was happening. That one of the male nurse, I think our CM sir was prized him and given certificate, so many things, which came in all social media. That's why everyone is here, they run out. But he went inside and he has helped with all the children came out. This is also empathy, this is also compassion. So the compassion will come once, it will not go away. Because you transformed yourself, nobody changed you. So being a person, different than professional. But nurse is the only person, be the person then become professional. That's a very great compassion. I know that today nurses have everywhere demand. And nursing program, everyone calling me, can you help me get one seat in Tamil Nadu? You know, you have many friends. I told no seat in Tamil Nadu. Because now is also no. Because they want to study in Tamil Nadu. Because the structure, like what institution you have, you come to North, you realize that really I am so much, you know, madam, and the way you spoke, sir spoke, and the information. Because I have visited across India, most of the institutions. I have, you know, met so many people, you know, if you come to know the social media. There is some institution so good, what is not only entered, that I see the spiritual, the power, energy, I told Kavita, actually very good. So that is not only that, the vision of the person who is doing. The vision, that vision is make them to sustain, make them to, you know, do something good for the society. That's why I am very proud for you and sir, which he has the vision to expand and is benefiting the society through your student, what you are producing. Wherever you are witnessing, that you are also told me. That's what I am telling you, this is the only profession today highly demand. It is not for the business alone, I am telling you. Many colleges starting with business. I know that because they want to retain, they have to pay salary for that. But that is different because that's both are equal. But majorly there is a service. They are producing the good nurses. But qualified nurses are very difficult to come out, I am telling you, because you have the facility of hospital. They get training in-house. They are able to train, they can able to qualify when they go out. They can be next day they can able to do whatever. But today I am in the government hospitals. The nurses after finish the offset exam they coming inside. They don't know how to give injections. They come from Rajasthan, different state. But today they are selectively asking, we want nurses from Tamil Nadu. We want trained in Tamil Nadu. That's why I am telling you, Tamil Nadu, Kerala, these states are, and some of the college in Andhra, highly today they are doing very good institution like this, and they are doing very tremendous. And that's what today needed, not only the nurse, qualified nurse. Again, I want to, you will become true nurse. Today it will not happen. I am telling boys, I was there like you. Okay, we were very naughty. And that's why I asked Kavita when I was sitting alone. I told, what you have seen 23 years, lot of transformation, lot of transformation. How it has happened? You are very lucky. You have 100 students. I have only 22 students. One student joined, he is male, he left. He is from, Bengaluru, and 2 boys, myself and Sudhakar, okay, and another 19 girls, and all of them settled in different places. But 2 boys, we experienced both. That's what our life of is. Then later on, we met someone in a mental health hospital. You know, there we met so many nurses, so many students. That time we have to go for training, IMH. But you boys are very lucky. You are seeing me and seeing the teachers. That time we have 3-4 teachers. They are also not MSc. But today you have very good facility, very good students, your friends, and you learn from everybody more. And that is today's status of the nursing, especially after COVID. It is tremendous changes. After COVID in India, and job opening, I think everyone knows that. If you are selected through NORCET, because I am also being the person involved in this exam, many of the exam in AIM, so many things. Today, if you are completing your 4 year, you clear the exam, NORCET exam, you will be appointed in AIM's mother tomorrow. Your salary is 70,000-80,000 as a government person, in the hand. Total salary is 90,000. Even what Madam told you, a computer person will not get government job. Anyone will not get, you are the one who will get. Another one, this is every year 10,000 vacancy. You want to Tamil Nadu, otherwise Mangalagiri, Vivinagar, even tomorrow all the state will open. and this is a huge demand other than private hospital. What madam telling you, many nurses, somebody requesting her to give nurses. That salary maybe you are getting 15,000-20,000, maybe because according to their patient bed strength they will pay, not like everyone want to do good pay according to what they are getting. But in government job, 60 salary, but for that exam not easy. What madam told you have to come dedicatedly to prepare. You attend all the classes. The questions not easy. Questions are very different. All clinical point questions. If you see the patient with the heart failure with these presentations, with these investigations, what you will do? Because they are expected that you know the patient information and how you treat. They want to know about your knowledge and pharmacology. And again, you also different situation. How being a nurse you act. That means that is not happen when you are sitting only in the classroom. You go to every day, go to the patient. Don't look for who is the supervisor, whether they will come or not. You have to be focused for it. Because when we were students, we went to Chengalpet Medical College. I was the first batch of Bengaluru Auditorium College. So we were every day go to the same like you earlier you went to government hospital. Now you have own hospitals. Own hospital, different than government. Why? Because government many people will come, but your own hospital you are the boss, and everybody will help you, support you. So that's why please learn, because what I tell all of them are motivated, sir, motivated. I don't want to motivate because already you are motivated. I want to hear who call me to see that, only to say that nursing is not like what you have seen 20 years before. Today nursing is lot of changes, and you are going to become nurse practitioner tomorrow. Already I am working in the government in different areas. The nurse practitioner, because I am very proud to see that all program are here. Tomorrow you will start nurse practitioner. I am very much glad to going to see you, madam. Nurse practitioner program we are giving only to the government medical college, hospital college, not for everybody. That time nurse practitioner is independent job. I think everyone know that. You will assess, you will treat it. Don't wait for the doctor. Only in any situation there is a protocol, you have to ask the doctor. Otherwise you have become, you wear the stethoscope, you are like a doctor. This is what expecting everybody nurses. Because nurses devoted. Nurses are very good to do everything, but they want only one thing, it's a state respect. The respect which you want to give. Like mother is like my mother, she is not educated. She is illiterate. But nothing can replace my mother. The values are very, very high. No one can replace. So that same thing, nurses never replaced by either you are male or female. Once you become true nurse, I am telling you, you are completely devoted. You are all the time to hand, your heart. That's why we used to say, your mind, heart, your hands. These are your weapons to help anybody. So that's there. Everything will come to you. Whatever you have knowledge, everything, the people approach you. The people will welcome you to take any responsibility. Same time, everyone will respect you because you are independent and your service is required. That never replaced by anyone. Even doctors, they are very important in the society to treat the patients. But same like I told you, that is the nurses there to give only the energy, the hope for the patient. Hope for the patient. It is not happened in the COVID. The COVID, everyone think isolated, nobody there, nurse only given the hope. The treatment was not effective at that time. The hope is given by nurse, you will alive. That's what happened everywhere. So that's why nursing is coming up as a very great profession. Every time when I met the student, I am telling you this information. I met so many first year students in AIM Delhi, topmost student come to AIM Delhi. They missed 2-3 marks in the meet, they come to B.Sc Nursing. The parents told me, this job is good, now you join. Then they used to depress sometime. Oh, next time I will try for the MBBS. Then I asked them one day, I see every batch like this. I asked them, what is that, the problem, why you are not continue to be nurses? Then they told, sir, any profession, I can reach maximum because I am very much knowledgeable. I can study more, but I feel nursing cannot possible. Then I told you, write in the Google Gopichandran. You read. Then next I just gave an example because I told today the nursing, not like me, many people like me, they are doing very good because we also felt during the time, only there is a B.Sc Nursing, that's how we go to abroad. Today there is like you have seen your senior MSc, then you can become PhD scholar. Because I am today the consultant, like consultant means you are independent practitioner with the patients and you become administrator, especially after I am NIMHANS assessor also. Every month I am getting, too many calls from NIMHANS to do the assessment of licensing the hospitals. Even today or tomorrow also I can come to your hospitals. Yesterday I got call from Amrita Hospital. So like this, we are today essential need to become different role, not only as a earlier days called staff nurse. They remove the word, now become nursing officer. Okay, so that way earlier we thought that when you become B.Sc, I can become only one job as a clinical nurse. No, if you have knowledge, you are there, you want to do hard work to explore nursing. There is a same like profession like medical science, and you become specialized nurse. Today I am neuro nurse. Earlier medical surgical nurse. You now become neuro nurse, oncology nurse. You can be extended in any level if you have knowledge, your hard work, and your commitment, you are passionate. And again, everything will come. Your core is compassion. The core is your value. If you remove the core, you are nothing. You are like an arts person, you are like other person. So with that, I don't want, it's a lunch time. I know it's advice is not good for during the time. Yes or no? And everything hungry, and the students are really, spend lot of time for a lot of exercise for arrange this. I came for only, I told you the reasons which I bonded with Indira, College of Nursing, my friend Sudhakar and another friend Kavita, I came. But I thought that when I come here, what I am going to do, what I am going to speak, I realized that just be stand and show, give the confidence to you. You can also do many things, not like Gopichandran, 100 times more. Because I started in 93 nurse, you have started 2023 nurse. You become more 100 times. That 100 times means become so good in your life. And another one, you are studying that one of the topmost institutions, which I already go to, to your lab. You will keep remembering on us, and again we will continue. I told Kavita, any time, any help, it is required. I am there to help. It's not only here. I travel many places. Some of the institutions I attach some reasons. And after listening from your MD and the chairman, I am so happy that this type of institutions are really lucky. Students are lucky because they have the great missions, and definitely it is going to be many programs tomorrow. Again, one day I will come, and we just be there with them. Thank you very much, and once again, and it's so good. And again, anything what Madam told, anything you call, anything the same, like wherever you find any of the things, especially not only the freshers, any of the students, anywhere you meet, even I have PhD program in Europe, I have master, all are stipend, 20,000 you get MSc when you come there. Every month, it's a government program. And PhD you get 35,000. And especially I am telling you, one day Indira College of Nursing is come to me as I am student of PhD everything. That day I called Madam and told Kavita, but I am very strongly believe you come. Any Tamilian student do well, and I see this infrastructure and because I know Kavita very well, we were, I told her morning also, you become one day administrator, I realized today I am seeing you. This is what that. So it is what actually that everything, the belief, everything will be go. Same way I am telling you, you will day one day you become the good as the professionals, and keep do, and don't compare with someone is stopped B.Sc after that. Today girls are empowered with education. Girls are empowered, and nobody empowered. Only they are only empowered. That's all. Nobody helped them. This is what today the truth. Don't stop your education. That education make you what you want to be like, and explore that make you the best in your life. And again, boys, you are taking the right profession. Just see me like this, or many people are like me, and you follow that and take the professions in a very great way. Thank you very much. Thank you.
We are excited to have you among us, sir. Thank you, sir.
Sir, thank you so much, sir, for encouraging us, and you told me about the nurse practitioner today. And already it is emerged in Tamil Nadu. Already Ramachandra University has started this. Actually, we need more awareness to do nurse practitioner after finishing their B.Sc Nursing. So we would like to aware them also. We thank you so much. You encouraged a lot, and you remembered us. Sudhakar sir. Actually, we felt so sad that you said that, because we were working together with Sudhakar sir. We remember. We thank you so much, sir. You have given so many information to the nurses, and also for us that to our MD ma'am to start the nurse practitioner courses, and also the PhD program as COSS soon I will start academy. You will join as a first candidate. You definitely will join as a first candidate in PhD. We are proud our MD ma'am and our chairman sir and our principal, Dean ma'am, all of for their encouragement to this new buddies. Thank you so much, sir.
As I told, will be a most memorable event for your life. All this would have not possible without thanking. So I would like to call upon Mrs. Anbarasi ma'am, Assistant Professor in Department of Obstetrics and Gynecology.
As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. Good afternoon to all. I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all by giving glory to the Almighty God for making today's occasion a great success. First and foremost, we are grateful to our Honorable Chairman, Thiru Raajendran Sir, MLA of Thiru Constitution, and Srimati Indira Raajendran Ma'am, Managing Director of Indira Group of Education Institution, for the word of encouragement. The able guidance has always encouraged us. I thank them for their kindness, interest, hospitality and continued support. Thank you, sir. Thank you, ma'am. I thank our special guest, Dr. Gopichandran, Assistant Professor, Consultant in Neuro Nursing, Department of Nursing, NIMHANS, Bengaluru, who despite his busy schedule has found time to grace this occasion and for this valuable contribution. Thank you, sir. I thank our well-wisher Srimati Goddess Mary Ma'am, Dean of Indira School and College of Nursing, for her stewardship and unstinted support for this function. Thank you, ma'am. I would like to express a profound gratitude to Srimati Kavita Ma'am, Principal of Indira School and College of Nursing, for inspiring us to work with dedication, compassion and commitment and for constantly motivating us. Thank you, ma'am. I would like to thank our Vice Principal, Srimati Narmada Ma'am of Admin, Srimati Abhirani Ma'am of Academic. Thank you for your presence, ma'am. To the heads of various departments and the faculty for the valuable contribution, guidance and encouragement in all our efforts. I thank all the distinguished invitees presented here accepting our invitation. Last but not least, I thank all the students for your cooperation in making this function a resounding success. Once again, I thank you all for your attention. Thank you, one and all.
Let's finish up the program. Let us all rise for the national anthem. It is led by our B.Sc semester nursing student.
Jaya